Maybe you've heard that grapefruit can interfere with certain medications, but it's worse than you think. It turns out grapefruit can cause side effects when combined with about 85 different drugs, including things as serious as kidney failure, breathing problems, and internal bleeding. And it's not just grapefruit. Other common foods don't play well with some medications, including chocolate, licorice, and even black pepper. Let's learn more from CBS Medical contributor Dr. Holly Phillips. Dr. Holly, I'm worried now.
Good morning, Nancy. Yeah, it is worrisome. The most important interaction is really between grapefruit and grapefruit juice and medications that bring down your cholesterol. That's the interaction we worry about most because it is the most severe. Basically, grapefruit has a compound in it that prevents the breakdown of the medication in your intestine so your body absorbs more. And you can end up having a toxic overdose just taking your regular pill every day.
So does this mean you have to give up grapefruit for good if you're on one of these medications?
Well, you know what, in a word, yes. And that's not easy to do. A lot of my patients say it's part of their morning routine, like coffee or cereal or whatever you do. But there is a new designer grapefruit coming out. It's true. Some researchers in Florida are working on a hybrid between a red grapefruit and a pomelo fruit. So it's supposed to be sweet and even juicier than other grapefruits, but most importantly, it doesn't have the compound in it that interacts with medications.
There are a lot of surprising things on this list, including licorice, really?
Yeah. Yep, we worry about licorice with the heart and blood pressure medications, and it can affect them either way. It can decrease the effectiveness of the meds or lead to a toxic overdose when you're not aware of it.
The next one is really troubling. It's chocolate.
It makes us all very sad.
Yeah.
It interacts with a number of medicines. The most worrisome are the antidepressants and stimulant drugs that are used for attention deficit disorder. It can actually raise your blood pressure and your heart rate when mixed with those drugs.
But are we talking about a lot of chocolate, like you need to be eating bars and bars, or just a little bit?
Just a little bit, unfortunately, Nancy. It just takes a little bit. It has to do also with frequency. The more frequently you have it, even if it's a small amount, the more likely you are to get the side effect.
Also on this list are leafy greens. Now, what's in that category? Vegetables, spinach? What are we talking about?
You know, kale, collard green. The leafy greens are, of course, high in vitamin K and potassium, which is wonderful unless you're on certain drugs, particularly blood thinners. They block the effects of blood thinners, so you think you're protected and you're not.
The next one I had heard about before, dairy products like milk and yogurt that can interfere with certain medications.
Right.
What kinds of medications are we talking about?
The most important are the antibiotics. Dairy products can decrease the effectiveness of your antibiotic, and they can also cause stomach problems.
And black pepper is on the list too. That's another one that, I mean...
It is. And black pepper really interacts with allergy meds, antihistamines, and of course it's pollen season now, so we should pay attention to that. It can increase your blood pressure and heart rate on those medicines and also cause nervousness and anxiety.
How are people supposed to know about these interactions? Are they on the labels of these medications?
Right. You know, some of them are right on the label. In fact, you can get some bright orange or yellow labels on your bottle with grapefruit, but not every single one of these interactions is on the bottle, and frankly it's hard for doctors to keep track of it. The best thing to do is read that thick handout that comes with your meds, and also just ask your pharmacist directly, do any foods interact with what I'm taking?
Great advice. Very eye-opening. Dr. Holly Phillips, thank you so much.
Great to be here.